Hi everybody.
Hi everyone, good morning.
A very good morning to all of you. Welcome to the World Breastfeeding Week. We are here today at Jehangir Hospital to discuss and to troubleshoot with all of you and help you find out everything that you need to know about the World Breastfeeding Week. I have with me today, I'm Dr. Neena Mansukhani, a consultant at Jehangir, and I have with me today Rachita Duggal, who is a lactation consultant with us since several years, and she's the go-to woman once you deliver. So, welcome Rachita.
Thank you so much, ma'am.
So, can you tell us a little bit about the World Breastfeeding Week?
So, the World Breastfeeding Week is celebrated every year from the 1st to the 7th of August. And this year's theme, so every year we have a theme. And this year the theme is to prioritize breastfeeding and to create a sustainable support system for breastfeeding mothers. So, whatever activities we are doing this year are centered around that and to help the mothers be supported.
Support is the key word. Let's all work towards that. Can you tell me in which ways a breastfeeding mom could be supported?
Oh, many ways actually. The first and foremost is at the family level. So the partner, the family members of the mother can help in supporting the mother by providing her emotional support, encouraging her to breastfeed, telling her that it's okay, it can take time sometimes. Also helping her with any non-feeding tasks like changing the baby's diaper, burping the baby, helping around with household chores like, folding laundry, for example, or cooking for her. These are basic tasks that a family can help.
I hope the dads are hearing.
Really. And at the hospital level, a mother can be supported by providing her skilled lactation care. So all the staff can help by encouraging the mother, teaching her how to do it correctly, helping her position the baby in the right way, ensuring that the baby is transferring milk well, latching well, and troubleshooting whenever the mother is facing any issues.
Absolutely. I think breastfeeding is a huge task as soon as a mum is born, because they say when a baby is born, a mum is born.
Really?
And it's really the first, difficult task that you're confronted with. And I can vouch and I can endorse that the fact that Rachita is such a boon to have around breastfeeding mums in the ward, and it just transitions so smoothly into motherhood and breastfeeding once she's around.
Thank you so much.
Thank you
also,
for that.
I feel, support at the community level can also be provided.
Of course.
Very simple things like having a clean and private space to feed.
That is so important.
Right. So, in fact, one of our patients had only mentioned recently about the feeding rooms that are available in Pune. So, a lot of times mothers are asked to go and breastfeed in the washroom. And I mean, that's one of the saddest things. Really.
Yes. So I think India is changing to some extent, because I see breastfeeding pods now at airports and in the railway stations, and they have dedicated rooms even in malls sometimes.
Right.
So I think that's a start.
Absolutely.
Where do you think your role lies in today's obstetrics, a lactation expert? When all do you think that expecting couple should contact you? Before, during, after, like during the pregnancy? Can you help us with a few points on that?
Right. So, especially for first-time mothers, it's important that they get accustomed to breastfeeding, or at least learn about breastfeeding during their pregnancy period. So, the first point of contact should be during their ANC visits, and ideally during their third trimester.
All right.
That's when they should come in, and the important things that we'll touch upon then would be to share the importance of breastfeeding, explain how to breastfeed the baby, help her set a breastfeeding goal.
Okay.
So how long does she plan to breastfeed? Is she going to join back work in a few months? How is she going to continue breastfeeding post that?
Right.
Explaining to her about what are the various options available when it comes to pumping, etc.
Yeah.
Also teach, more importantly, and that's where you come in, to check the breast anatomy.
Anatomy, yes.
So if in case there are any issues with the breast, then we, it helps to anticipate those problems prior to the mother delivering. And the second visit should be, or the second point of contact with the lactation professional should be right after delivery. So that is at the hospital, during the hospital stay. That's where we come in and help the mother position the baby, feed the baby, teach her whether the baby is feeding properly or not.
Ideally in the first 1 hour after birth, because
Right.
that's called the golden hour.
Exactly. So we
Yes.
want to start breastfeeding immediately after birth, and we want to ensure that the baby is taking in that colostrum which the
Yes.
mother is producing to help stabilize the baby's blood sugars, to help
Yeah.
stabilize the baby's body temperature, and have a more successful breastfeeding start. The third point of contact should be after the mother is discharged,
All
and
right.
those would mostly be follow-ups. So if the mother is facing any issues after going home, and a lot of times those issues would be with oversupply or less supply, or the
Yes,
baby
that's true.
becoming colicky, things like that. So that's where a mother needs those constant feeding supports
And reassurances.
Reassurances,
Yes.
absolutely. A lot of times, babies after a few weeks will go through growth spurts, and they will start to feed quickly or
Correct.
in short spurts. And a lot of times,
Yeah.
mothers will think my baby's not getting
Not getting enough.
Right. So
Yeah.
that's when a lactation person can help in understanding what is going wrong and help
How
them
much is
troubleshoot.
enough? Yes.
Absolutely. The next point of contact would be when the mother is thinking about transitioning to solids.
Solids.
So how do you balance transition solids as well as breastfeeding
Yeah.
alongside? So that the myth is that once the baby starts to eat food, they'll be full with the food and breastfeeding has to stop. Whereas that's
No.
not the case.
Yeah.
Breastfeeding is still important in the first year of life, and solid foods when we begin at 6 months are complementary.
Yes.
Foods. So we want to, how do you balance both, and how do you ensure that the baby is still getting enough nutrients?
Nutrition. Yeah.
And lastly, when the mother, or if the mother is returning to work. So that is where a lot
Pumping
of help,
and,
absolutely.
freezing.
How many
Yeah.
hours is she going to spend at
True.
office, at home? So those are the different
So
ways.
we had about 5 or 6 points of contact where a lactation expert can really help you. I also want to know, Rachita, from you, what are the difficult scenarios that you have faced during your practice as an LC?
So different scenarios actually. The first one being, if a baby is born too early, or which we also term as premature baby.
Yes.
So these babies sometimes don't have the strength to suckle. They don't have the sucking and swallowing coordination developed, which is not developed very well. So these babies need support by feeding via a spoon or through a tube. And for these babies, breast milk is extremely important.
Yes.
These babies need that mother's milk to help them grow.
And also the immunological factors which will help them fight the outside forces, especially when they are preterm.
Absolutely. So a lactation consultant here can help in by, helping the mother express milk,
Yes.
by teaching her how to ensure that her milk supply is protected, because the baby is not suckling at the breast.
Yes.
So how do you ensure that happens? So that's one of the
different
cases.
types of pumps which may be required in these scenarios to express the breast milk.
Absolutely.
Right.
So that's one of the cases.
Yes.
Then another case would be a big baby, or what we
Oh,
also
yes.
term as a large for gestational age.
Right.
So a lot of our bonny babies, which you've delivered,
Need more.
Right, need more milk, exactly. And sometimes the mothers may be dehydrated or has not started to produce milk right away. So in those cases, how do you support the mother? How do you teach them the frequency of feeding?
Correct.
How do you ensure that the baby is getting enough milk in those scenarios? Another would be twins, breastfeeding multiple
yes.
babies. So
It's never enough.
It's never enough, really.
Yes.
So how do you ensure the babies both? So a lot of times, one baby is feeding and the other would start crying.
Yes.
So how do you teach them different positions where the babies can be fed together? Or how do you ensure both babies are getting an equal amount of breast milk?
Yes.
Also, another scenario where I would have helped would be, babies who are born with a congenital heart defect.
Okay.
In that case, of course, one has to be very careful about the baby. While they're breastfeeding, you have to be careful about them breathing properly. They should not aspirate the milk. So a lot of those conditions have to be explained to the mother properly and taught how breastfeeding, because these babies will look very normal, but a lot of times you have to look for small cues to help them understand what's going wrong. And one of the very challenging cases that I dealt with was a baby with a cleft palate.
Yeah.
So that's basically an opening in the palate of the baby's mouth. And
so they're not able to latch on properly.
Exactly. And the milk actually does not flow into the into the esophagus. It goes into the windpipe. So here we have to be
that's
careful.
worrisome and scary.
Absolutely. So here we have a lot of help in terms of different types of special feeders which are available today.
Yeah, correct.
Which help the baby get enough intake of
milk. And
it
goes in the correct food pipe.
Correct. Absolutely. So these are the various cases
that is
that I would have
so
dealt
useful,
with.
really very useful. So I just want to bring out a few common problems that, a new mom might face.
Right.
And let's just troubleshoot those for them.
Right.
So the commonest being, I'm not getting enough. And what do you do about that? The patient has gone home, and third, fourth day, she's like, I'm not getting enough. The baby's not gaining weight.
Right.
How would you tackle that?
So typically one needs to first address and understand what is the challenge, why is the baby not getting enough. So
Yes.
very commonly, if the baby is not fed adequately or regularly, that's where the supply
It
takes a hit.
diminishes.
Absolutely.
Yeah.
So we have to ensure that the baby is feeding adequately and also feeding in a certain frequency. So ideally we want to feed the baby every 2 to 3 hours.
Yes.
And during the day as well as in the night. So if you're skipping feeds or if you're feeding inadequately, that's where the supply goes down. And we want to ensure that we are correcting that first.
Okay.
Sometimes the mother may not be very well hydrated.
Hydrated, correct.
So we tell them to correct their hydration. We tell them to take enough water. So at least 2 to 3 liters
Of water. That I think we always do tell them.
Right.
In some communities, of course, they restrict that. But please remember to have at least 2 to 3 liters of water once you go home after whether it's a normal delivery or a C-section. Please remember to stay well hydrated.
Well hydrated.
I think it's another important point is that, babies do lose 10% of their weight in the first few days, like about a week to 10 days after birth.
Right.
So don't look at the weight of the baby. Instead, look at whether the diapers or the nappy is being wet.
Exactly.
That is a way to determine whether the
Absolutely.
milk
Right.
is
So helping them understand
transferring.
what the baby's output should be
Yes.
after you've gone home to reassure the mother. Again, that's where
Correct.
support comes in.
Yes.
To reassure the mother to help her understand whether the baby is getting adequate milk or not.
Okay, a patient messages you, my baby is not latching, crying for 45 minutes, I'm trying, I'm not able to latch the baby.
Right. So very commonly babies are gassy because of drinking milk. And sometimes because of that discomfort of gas, they are unable to latch. Right. So at that time, typically I advise them to burp the baby first, calm the baby down, and then bring the baby onto the breast again. So mostly the skin to skin position works very well.
Right.
That's also called the reset position, when the baby calms down, they relax, and a calm baby will always latch very well on the breast. So most of the times that's an issue. Sometimes it could also be just the baby has dirtied their diaper.
Right.
Helping them understand that, So it's a combination of 4 or 5 things sometimes.
And sometimes the latch may not be perfect.
Absolutely.
Based on the anatomy of the woman in question.
Right.
So yeah, I think you could help with that as well.
Absolutely.
Okay. Fourth day after birth, patient calls and says, I'm having fever and the milk is not coming out. What do I do?
Right. So most importantly, fever is a sign of infection, and we don't ignore that right after delivery at all. So we want to ensure that the patient goes and gets this evaluated by their doctor.
Certainly.
Now, fever typically can come in, or engorgement along with that can come in the breast because of overfilling of the breast with milk. And if that milk is not released, which is by feeding the baby or by pumping or hand expression, then the mother can develop fever or infections in the breast,
which is called as mastitis. And if this is not addressed immediately, it can lead to an abscess or a pus-filled cavity in the breast. So I would recommend, and it is recommended, that please do visit your doc in case of such problems.
Right.
My baby is sleeping all the time. 4 hours, 5 hours ho gaya, baby nahi uth raha hai. What do I do?
So one needs to, like you said, the baby is losing weight.
Right.
So sometimes they're also becoming lethargic because of that. So you want to ensure that the baby is feeding every 2-3 hours. So the easiest way to wake up a baby is to unswaddle them, open their diaper or change their diaper, pick them up for a burp, and then bring them to the breast. So 2 to 3 hours is typically the window that we want to, or in the intervals we want to follow. And sometimes when the baby is not feeding well or becoming a little drowsy on the breast, a little tickle can help. So stimulating them on the feet or at the waist or at the neck, these are places where you can, stimulate,
wake them up,
right, and keep them active through the feet.
What would you tell a mother who says that I'm getting pain while breastfeeding?
So very, very common again. Most importantly, one needs to understand that the pain, there is a cause for that pain, right? So very commonly it's because of the latch.
So breastfeeding should be pain-free.
Right.
I mean, pain-free, painless.
Absolutely. When it's done correctly, it's not painful at all. And if there is pain, continuous pain on the breast, then the latch is typically incorrect.
Incorrect.
That can happen again because of many reasons. It can be because of flat nipples or inverted nipples, or the baby is not opening wide enough and latching just at the tip of the nipple. And that's where the pain comes in. And the mother will always complain about soreness and maybe sometimes even cuts when it becomes really bad.
Sometimes even thrush of the duct, the milk duct, can also cause severe pain. And I've had a couple of patients with that.
Right. So correcting the latch is where this will
Important.
address the pain of the patient.
Right. When would you tell a patient typically to contact her gynecologist?
Well, the gynecologist, they need to be in touch constantly with them,
Right.
and they need to inform them about any small issues that they are facing. Because, you know, when they're coming to you with a problem early on, I think that's when we can troubleshoot and make it better much faster.
Yes.
A lot of times they will wait, or, you know, wait for things to improve on its own naturally, which may not happen always.
Right.
And they need to contact immediately. So during that pregnancy period, they need to, of course, you know, have a discussion with the gynac and understand how they can help or
Right.
make their breastfeeding journey successful. Where do you think they need to come in? And
No, that's what I was actually getting at. Post delivery, I would think that if you have fever, if the swelling in the breast is not going down,
Right.
and if you're unable to pump milk or express it, definitely please contact, because those are signs of an infection then.
Right.
And yeah, I think that's the most important.
Most important. Right.
And I would just like to ask you, as policy makers, what should people keep in mind at institutional levels where breastfeeding mums are concerned?
Well, I think most importantly, I think there needs to be a change in in HR policies, I feel. So,
Yeah.
make the workplace more breastfeeding
Conducive.
friendly, more
Yeah.
conducive. So, firstly, allow breastfeeding mothers to come back to work at the same level as their peers.
Absolutely.
Secondly, provide them with breastfeeding spaces, clean and private breastfeeding rooms inside their office facility, where they could at least pump and store their milk in a safe environment. And also maybe providing daycare options for their babies so that they can bring their babies to work.
That is so brilliant.
And lastly, of course, offering them hybrid working options. So a lot of the companies nowadays are working from home.
Absolutely.
So allowing them to take an extended period of work from home, and once they are comfortable coming back to work, they should be able to
Keep a mother happy and she'll work.
Absolutely.
Right. If we have any questions from people, we are quite happy to take them.
Right. I think we should pick them up. So one of the questions we have here are, what are the best ways to continue breastfeeding after returning to work? Right.
She's already just, you might want to say a little bit about freezing.
So yes, yeah. So actually the easiest way to do that is to learn how to pump or to express your milk. So because then you can continue to express and store your milk and leave it behind for the baby. Once you've pumped your milk, once you've freshly expressed it, you can store it at room temperature for up to 3 to 4 hours.
Yes.
In a sterile container. If you're planning to store it in the refrigerator, then you can store it for up to 4 days.
Yes.
If you're planning to store it in the freezer, the regular fridge freezer, it can be stored for up to 3 months. And once you're taking it out of the fridge or the freezer, they shouldn't be warmed up directly on the gas or in the microwave. They should be put in a double boiler, so a container with hot water, and the bag of milk should be kept in that to thaw slowly.
Once thawed, you can't freeze it back.
Right, absolutely. A lot of thank yous for you, ma'am.
Thank you to everybody.
We have some more questions, I think. What can I do to actively support my wife during her breastfeeding journey, both emotionally and practically? That's such a lovely question.
A hug a day.
Absolutely. And getting her snacks during those midnight feeds.
Yes.
Making sure that you're supporting her with providing her, ensuring that her positioning or posture is correct and she doesn't get any back pain or neck pain.
Yes.
Right.
And of course, doing the other tasks, supervising around the household chores like Rachita mentioned, because unfortunately, you can't breastfeed, only she can.
Right, absolutely. Right. What are the most effective ways families and workplaces can support mothers to successfully continue breastfeeding? So I think that's the first thing we've answered.
Covered.
Right, we've covered that, right. Right. And at what stage of pregnancy should one take Shatavari? That's a question for you, ma'am.
So Shatavari is basically asparagus extract, and it's like a herb which helps in development of breast glands and of the breast, and it helps in milk production. So the breast formation, the change in the breast starts very, very early in pregnancy, expansion of the breast, development of the areola, and in fact, milk production starts as early as 16 weeks when you're pregnant. But it's essential to take the Shatavari probably just in the last trimester, particularly I think 1 month before. In Ayurveda and certain sciences, they do recommend it throughout the pregnancy, I think. I'm not so sure about that, but I think it would be prudent to start about a month before your delivery date.
Right.
And if you're diabetic, please make sure you're taking sugar-free one because it spikes the sugars then.
Right. Is it necessary to bring a breast pump in the hospital bag?
No, everybody does not need a breast pump, and I think your lactation consultant would be the best person to decide if you're unable to, get a perfect latch, and if it's very painful for you despite doing everything, or if your baby is premature, then you might need a breast pump. Don't buy them unless she recommends it, because you might not be buying the correct one.
Correct. Absolutely. And there are so many options available these days.
Yes, exactly.
The wearable ones and the electric ones.
The mechanical one and the electric.
Right. Absolutely. I think we're through with the questions. Right.
So I think thank you everybody, and wishing you all a happy World Breastfeeding Week. And we hope that everyone's able to do it. Just one last point. Please never ever pressurize yourself and be easy about breastfeeding. It may not work for everybody. So don't let it be a point of contention, and let's work towards it nevertheless.
Thank you so much.
Thank you.